The Guam Department of Education reported Tuesday that there were 4 additional students that tested positive for the COVID-19 virus, bringing the total number of students with the virus to 44. The Archdiocese of Agana has also reported that 8 additional students have also contracted the virus, bringing that total number to 15. With the Delta variant, the more transmissible strain of the virus on Guam, we spoke with Pediatrician Dr. Michael of One Love Pediatrics. He has been treating the island's most vulnerable children for 6 years, who shares what parents should be looking out for when they are experiencing flu-like symptoms.
So if the parents are feeling ill first and then the kids get sick, I think that's a pretty good time to, think about getting tested. Thankfully, kids, even with the Delta variant, seem to be doing pretty well in terms of not being sick enough to be hospitalized, right? Because most of them, if they're under 12, they're not going to be able to get any shots.
If a child becomes infected with the virus, this is what parents should be paying attention to.
So with the kids, they're probably going to look like they have a cold. And so you just treat it symptomatically, keep them comfortable, keep them well hydrated. And then, of course, be very vigilant for any breathing issues. I always tell all of my patients, even if they just come in with a cold, we don't know if the virus can go down to the lower respiratory tract in most colds. Like we can't tell just looking at cold, hey, this is RSV, this is some type of coronavirus, this is a rhinovirus. But there are a handful of viruses that can go down to the lower respiratory tract. And what I tell parents to look out for is the first thing you should look out for if you think if I think it went to the lungs is that kids start breathing faster. So that's their first way of trying to compensate.
If they're breathing too hard and out of control, parents should bring their child to the hospital. Encourages parents and eligible members of the household to get the COVID vaccine if they haven't done so already, and to continue to hold the line.
But maybe consider, keeping that mask up a little bit longer, a little bit more social distancing. And so, yeah, if we protect the adults from getting COVID, that's how we're going to protect the kids from getting COVID.
Reporting for Guam News Network, Wahoo Isaiah Ugin.